So let's review the MCQs on vitamins and minerals. Well, this is the first part. First part will be just on vitamins. So question 1 says, burning foot syndrome has been ascribed to deficiency of what? We said it in class that day. The answer is vitamin B5, that's pantothenic acid. There will be tingling, burning, hot sensation on the foot. So that's called burning foot syndrome. In which of this organ is cholecalciferol hydroxylated to 25-hydroxycholecalciferol? So if you recall, I said the sunlight will hit the skin. So that's what I drew in class that day. So the skin, we have dihydrocholesterol present on the skin, dihydrocholesterol. So once the sun ray hits it, about 8 to 12 minutes of sun exposure will convert this to cholecalciferol. So cholecalciferol now is sent into the bloodstream, bound to a protein called DBP. That's vitamin D binding protein. So cholecalciferol is here now flowing in the bloodstream. So it's going first to the liver. So at the level of the liver, it is hydroxylated on the 25th carbon to become 25-hydroxyl cholecalciferol. This is then sent to the kidneys now. So at the level of the kidneys now, we're now going to have the hydroxylation at the carbon 1 if calcium levels are low, or hydroxylation at the carbon 24th carbon rather if calcium levels are already high. So assuming the calcium levels are low, this will be sent to the kidneys, and the enzyme that is functional here is 1-alpha hydroxylase. Hydroxylase will convert 25-hydroxycholecalciferol into 1,25-dihydroxycholecalciferol, which is also called calcitriol, our active vitamin D. So the question asked, where is cholecalciferol hydroxylated to 25-hydroxycholecalciferol? The answer is the liver. So that's the answer here, option B. Question 3 says, unpleasant odor and taste in fat, rancidity, can be delayed or prevented by the action of vitamin E. Is the answer. It's antioxidants, and it helps to prevent the oxidative processes that are causing PUFAs. That's fatty acid. Question 4 says, a deficiency of which of the vitamins will lead to a functional folate deficiency? The answer is vitamin B12, and the concept is called folate trap. So if we recall in our lecture, we said homocysteine can be converted to methionine, and this requires vitamin B12 to give a methyl group to this reaction. This methyl group actually came from tetrahydrofolate, who passed on this methyl group to vitamin B12. So if there's no vitamin B12, and in turn, after I pass on the methyl group to a vitamin B12, it can then be reconverted to dihydrofolate and also recycled, and the reaction all continues. So if the methyl group is not handed over to vitamin B12, we cannot have methylation of homocysteine to methionine, and this will lead to a condition called homocystinuria. So if we have vitamin B12 deficiency, folate becomes trapped in this methyl state, the tetrahydrofolate methyl state, and this concept is what we call folate trap. So the answer to this is vitamin B12. Question 5 says, a woman who eats a standard meat-containing diet has had one child born with a neural tube defect and is considering becoming pregnant again. Blood work showed normal levels of vitamin B12 and total folic acid. So specific type of folic acid was not specified. One possible explanation for the woman's difficulty in her first pregnancy is a thermolabile variant of which of the following enzyme? The answer is N5-N10 methylene tetrahydrofolate. This enzyme reductase, it converts N5-N10 methylene tetrahydrofolate to methyl tetrahydrofolate. So if this enzyme is not functional, we cannot have methyl tetrahydrofolate, and the child can be predisposed to having neural tube defect. So the answer to this question is option A. Question 6 says, subacute combined degeneration of spinal cord is caused by deficiency of cobalamin. This will lead to accumulation of methyl malonate. So methyl malonate will be the cause of the degenerative issues that the patient will have on the spinal cord, and can also cause peripheral neuropathies too. Question 7 says, The neurotransmitter GABA, gamma amino butyric acid, dopamine, and histamine are all derived from amino acid precursors. The generation of these neurotransmitters from the appropriate amino acids require which of the following cofactors? Neurotransmitters mostly are derived from transamination reactions also, or probably some reactions that require amino acids. And a key vitamin that plays the role of coenzyme or cofactor for them is vitamin B6, pyridoxine. Question 8 says an individual has developed pancreatitis and with it steatorrhea. The patient also reports problems with his night vision, which means he has nyctalopia, although visual acuity appears normal. Another expected finding in this patient will be which of the following. Now, since the patient has pancreatitis and steatorrhea, we're having issues with fat malabsorption, and if fats are not being absorbed properly, along with fats will be our vitamin ADEC. So ADEC vitamins, vitamin A, vitamin D, vitamin E, and vitamin K, they will not be absorbed. So you see symptoms in this patient manifesting with deficiencies of either vitamin A, D, E, and K, and he already has one. There's nyctalopia, which means vitamin A is deficient. So, and the options here that showed a deficiency of a fat-soluble vitamin, vitamin K, he will have easy bruising. So that's the answer to this. Question 9 says the vitamin A deficiency condition in which the patient cannot read in poor light is known as nyctalopia. So that's the Latin word for it. Question 10, a patient has had a series of blood clots and has been placed on warfarin to reduce such incidences. Warfarin exerts its effect by blocking which of the following? It blocks the enzyme called epoxide reductase, and epoxide reductase is needed for us to have hydroquinone, which is necessary for the gamma carboxylation step. So the answer to this question will be formation of gamma carboxyl glutamate. It would prevent or block the formation of gamma carboxyl glutamate. You can refer to your lecture slides for details. Question 11, the fat-soluble vitamin which serves as a coenzyme precursor is none of the above. No fat-soluble vitamins serve as coenzyme. Coenzymes are mostly with water-soluble vitamins like the B complexes and the vitamin C. Question 12 and 13 now. This story would be for the two of them. The story says a 64-year-old woman is seen by a hematologist for evacuation of a macrocytic anemia. The woman was severely malnourished. Both homocysteine and methylmalonate were elevated in her blood and urine, and the transcriptolase levels in her erythrocyte were below normal. So when you see elevation of homocysteine and elevation of methylmalonic acid, just know that this is talking about vitamin B12 deficiency. The classical, or should I say the single elevated product that will tell us that vitamin B12 is deficient is actually methylmalonic acid. So question 12 now says, what is the best evidence cited that this anemia is due to the primary deficiency of cyanocobalamin? The answer is elevated methylmalonic acid, option B. Question 13 says, in response to vitamin B12, which of the additional conditions may develop in this patient if she is not treated? When the methylmalonic acid begins to accumulate, it destroys the myelin sheaths, and the patient will then be predisposed to having progressive peripheral neuropathy. So option A will be the answer. Question 14. A 9-month-old child of strict vegan parents. Be careful with this question, it's very tricky. A 9-month-old child of strict vegan parents, the parents are vegan but not the child, is brought to the pediatrician due to perceived muscle weakness. Due to their strict dietary belief, the child has not been given vitamin supplements. An image of the anterior of the knee revealed cupped and widened metaphases. So you could see there's affectation of the metaphases. As the child is very fair skinned, the parent also covers up the child when they go outside, such that minimal skin is exposed to the sun. In order to correct this problem, the physician prescribed treatment with which of the following. Now note this, since they are vegans, they would not want to breastfeed the child. So the child was very low on breast milk, And since they are vegans too, obviously they won't feed the child with supply of meat substances. So the child was lacking adequate supply of vitamin D. And watch, he is very fair-skinned, so they didn't expose him to sun for the sun to synthesize vitamin D via acting on 7-dehydrocholesterol. So what this child has is lack of vitamin D, and is beginning to develop rickets, which could manifest as bowing of the leg or cane of the leg. Thiamine pyrophosphate, question 15 now. Thiamine pyrophosphate serve as coenzyme to the following enzyme complexes, except thiamine pyrophosphate is needed for pyruvate dehydrogenase as a complex, alpha ketoglutarate dehydrogenase. And in this one, it functions with other coenzyme. You remember the lecture I said if your girlfriend's name is Nengi, you have tender loving care for Nengi, where T stands for thiamine pyrophosphate, L stands for lipoic acid, C stands for coenzyme A, F stands for FAD, that's flavin, and N is for niacin, NAD. So the T here is thiamine pyrophosphate. So it's needed for these two here that I listed here. While transketolase, the coenzyme we need is just thiamine pyrophosphate. Transaldolase does not need thiamine pyrophosphate as a coenzyme, so that's the odd option here. So this is an end to our MCQ series on vitamins 1. So we'll continue the next series with the minerals, iron, copper mainly. Thank you guys.